with 16 new deaths recorded over the weekend, can you explain, if they're not happening in care homes, where are these people dying? And not necessarily geographically, but what are the age groups of these people? Because you have mentioned that younger people are getting sick now. So if you can kind of break down, how is it possible that 16 more lives have been lost?
Yeah, and there has been 2 of the deaths were related to outbreaks that are now over in long-term care, but somebody has passed away, and COVID is part of the reason. They may no longer have been infectious, but it may have been the thing that tipped them over the edge. But what we're seeing is people in our community, younger age groups, are requiring hospitalization and needing to be in hospital for longer periods of time, and it is those people who are now dying from this. We have seen several young people in their 30s and 40s who've unfortunately been severely affected by COVID. And this is one of the things we are working now. I've been trying to get the data from our team to put together around age of hospitalization. It still, of course, is riskier the older you are, but as we are protecting more and more older people, we're also seeing risk in younger people. And younger people are ending up in the ICU and needing ICU care for a longer period of time. But we will have some more statistics on that a little bit later this week.
Dr. Henry, can you elaborate more on what is behind the increase in younger people needing critical care? You mentioned more people in their 30s and 40s are being severely impacted from hospitalization to death. So what is the common denominator and why we're seeing this happen now?
Yeah, I don't know that there's a common denominator. There are many different factors. Some of it's related to where some of the community clusters are being seen. We saw that with some of the outbreaks that were happening in First Nations community, where people at a younger age were much more likely to need hospitalization or critical care, and sadly where we've seen younger people die from the virus. So it is partly that. It's partly as we're protecting more older people, there's more transmission in that younger age group. And if you remember the last time we presented it, it's on the BC CDC website. What we're seeing is increases again in the 20 to 39-year age group and up to age 59. So some of these are social transmissions, some of them are community transmissions where people are in crowded households, for example, and then some of them are work-related. So it is a matter of numbers. With a higher number of people in that age group being affected, the probability that somebody is going to end up in hospital at a younger age goes up. Some of it is underlying illnesses and underlying risks in the population where we're seeing transmission. And up until quite recently, we were having ongoing challenges and outbreaks in shelters and in places like the downtown east side. And this is where the success that we've been seeing in pockets of communities with vaccination really hits home. We've now seen a dramatic, 3 weeks after the push in the downtown east side, we've seen a dramatic drop-off, which is the good news, which is why we all need to keep hanging on for this next little while. I had the privilege on the weekend of having conversations with counterparts across the country, but with our counterparts in the UK, and they found the same thing, that once we reach a certain level, we will see decreases in transmission. And from the AstraZeneca vaccine, which they're using quite extensively in the UK, they had exactly the same, if not better, response in the community. So these are the things that we need to focus on for getting through this next few weeks in particular, and then we'll start to see the impact of the amount of vaccine that we've been able to provide in the last few weeks and into April. So what we are seeing is that it's because we still have fairly high numbers and the transmission is happening, but as older people are becoming protected, it is younger people that are more being affected right now.